Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, how can we improve attention and concentration problems following a concussion? And attention and concentration issues are very common, especially in younger kids who are diagnosed with ADHD or attention hyperactivity disorder. Or attention deficit and hyperactivity disorder, and that can be more of an attentive type or it can be more of a hyperactivity type. Well, actually concussions are one of the leading causes of attention problems among adolescents and then adults, or I should say teens and then adults. And this is because all concussions are all going to affect our frontal lobe right here, and our frontal lobe is what helps us with cognition, decision making, attention, focus. And so if a young teen or an adult has a concussion, chances are it's going to lead to problems at school or problems with work, problems focusing. And so there are many ways that we can improve that through therapy. And some of that includes proper nutrition, decreased inflammation. Some may include neurofeedback therapy. And then other forms are just trying to increase blood flow to the frontal lobe by doing some cognitive tasks, doing iPad games, doing some electrical stimulation. But today I want to talk about interactive metronome therapy. Interactive metronome therapy is a really cool therapy that coordinates a lot of different senses, from our vision to our sound or auditory system, and then our proprioceptive or muscle joint system. And all of these connected together can really help with this focus and attention issue, can really help the little brain that sits right behind our head at the base of our skull, the cerebellum, and it helps to really work on that cerebellum to drive activity to those frontal lobes. And so we're going to talk about an article in servicemen with blast injuries and how interactive metronome had helped all of their cognitive issues. So let's get right to the article. So here's the article. It's actually from 2013, so a relatively older article. It's called The Effects of Interactive Metronome Therapy on Cognitive Function After Blast-Related Injuries. But it is a randomized controlled trial. It's a pilot trial, so they did not have a ton of participants, but they had around 50, so actually 46. So we're just going to go through the abstract here. And so we report preliminary findings on the efficacy of interactive metronome therapy for the remediation of cognitive difficulties in soldiers persisting with cognitive complaints following this blast injury. Okay. So first of all, what is interactive metronome therapy? So let's just take a quick look. Here is a photo of a therapist helping an older lady go through interactive metronome therapy. And all that is she has a device on her hand that she's able to clap her hands to the beat. And the beat she hears in the headphones, but she can also get feedback besides from the headphones. She can get feedback from the screen. On the screen, if you're early, you're kind of yellow or red over here. If you're late, you're yellow or red over here. But if you're right on the beat, you're kind of in the middle on that green there. And so this therapy is trying to coordinate multiple sensory systems, coordinate that proprioceptive system of the moving the arms with the sound system or auditory system, and then with the visual system. And the cerebellum, as I mentioned before, loves to coordinate things. It loves information because it coordinates everything. And so by doing this properly, we can really get more of that coordination and to drive those frontal lobes. And then once people really get really good at it, then we can do other things. We can make them walk back and forth or walk side to side, make them stand on a half Bosu ball or do a balance exercise. We can make them do some dual tasking where they're thinking of words that start with a letter, or doing math like subtraction in their head or out loud. And all that should be possible while continuing to keep a relatively simple beat. Generally, the beat we use is 54 beats per minute, but we can adjust it and make it harder if we go slower. So that is interactive metronome therapy. Back to the article. And so with this article, they looked at 46 people, and they all had blast-related injuries from mild to moderate severity that had cognitive complaints, persistent cognitive complaints. They looked at people that received either the standard rehab care or standard rehab care plus 15 sessions of the standardized course of IM therapy. And so the standardized course is really just clapping to the beat. There's no extra activity, as we may do in our clinic. And so primary outcome measures were from this repeatable battery of assessment of neuropsychological status. Okay, and so they looked at multiple different tasks here, and in the results they found a significant group difference between that standard rehabilitation of care, which is basically just typical PT, cognitive rehab, maybe a speech therapist, or an occupational therapy. So whatever the doctor thinks is necessary, one of those four or all those four are going to be used. And then the ones that had the standard rehab of care plus interactive metronome therapy, it showed they had improved attention, improved immediate memory, improved delayed memory, all on this battery of tests. At the same time, they showed that there was effects in 21 of 26 cognitive outcome measures that were consistently in favor of that interactive metronome therapy. And this was just using 15 sessions of the interactive metronome in less than 5 weeks. So basically, ideally, it was 3 times a week, but sometimes they did a couple more, a couple less based on their time. So the conclusion was that in addition to the standard rehab of care, interactive metronome therapy can improve these neuropsychological outcomes in soldiers who have maintained this mild to moderate traumatic brain injury and improve their persistent cognitive complaints. So, I think this is a really good article. It's nice that it's in soldiers because we need more care for people in the VA or people that have trouble getting care, especially our servicemen and women. And so, but I really like that it just emphasizes the effect, and it's just looking at that interactive metronome therapy and how that can improve cognitive outcomes following a concussion. So, I hope you guys enjoyed this one. If you have any questions or comments, I'd love to hear them. If you have any suggestions for future topics, please let me know. Thanks again, and have a great day. Stay well.